Thank you, Mr. President. I rise in basic support of this bill today, and I will be voting for it. But as it was working its way through its legislative process, and as the work group worked on it over the last interim, I was often asked about this bill and asked whether I supported it or I opposed it, and my answer was always yes. I was both opposed and supporting of it. And I'll tell you why I was mixed as far as my thinking on this bill was concerned, because I don't think we've seen the end of this issue, and I believe we're going to have to deal with it again in the next session or the session after. This bill takes care of a very specific problem, and I congratulate the good Senator Przanski for the hard work he's done on this and getting this to the place it's at, and we should support this bill. But there are some concerns in the bill itself. One, the caps that are in place are for total caps. By that I mean they cap both economic damages, medical damages, and pain and suffering. And quite frankly, as a physician, I'm going to tell you that I think those are inadequate caps and always will be inadequate caps. We can determine what medical costs are for an injured patient, and we can determine economic damages. We need caps for pain and suffering because that's something that's difficult to do. But having a total cap that is of this nature is inadequate. The bill does call for an expeditious way of moving it to the Supreme Court, which I appreciate, because I think the first difficult case that occurs at OHSU will go quickly to the Supreme Court, and these caps will once more be thrown out, and we'll be back here working on the same issue again. The other issue for me is that what's good for the goose is good for the gander. Physicians at OHSU are in a special category. They are public employees, but they do the same things that all other physicians in the state do. They practice the same way. They take care of the same kind of cases. They run the same risks. And if they need caps for pain and suffering, then I believe all physicians do. That is not in this bill, was not in what this bill was supposed to do, and I recognize that and I appreciate that. One last issue. Medical malpractice is something that dramatically affects the cost of health care, but not in the way you might think. It does not affect the cost of health care from the point of view of premiums paid out or damages to patients or what tort lawyers receive. That's about 5/6 of 1% of the total health care cost in the state each year. The real cost of medical malpractice is the unnecessary things that are done to patients for physicians trying to prevent themselves from being sued. That runs 15 to 20%. $1.5 to $2 billion a year of wasted medical care, actually doing things that are hurting patients now. We estimate that 3 to 5% of all the new chest cancers in America are going to be caused by the excessive use of CAT scanners on people who are being CAT scanned purely for defensive medicine. These practices have to stop. Colleagues, someday we're going to have to deal with this problem in this state. Oregon is one of the most liberal states as far as malpractice is concerned. There's better ways of doing this, better things for patients, better things for the lawyers involved, and better ways of doing it for physicians. I look forward to working with others of you in this session next to bring true medical malpractice reform to this state, to bring health care costs down, to make sure our fellow Oregonians are safe. Thank you, Mr. President.